Thank you for your participation in the 2021 Virtual HPV Summit for Louisiana. This presentation focuses on ongoing gaps in childhood vaccinations and is presented by Pankti Pathak. This educational series is made possible through funding from the American Academy of Pediatrics and is brought to you by the following partners: the American Cancer Society, the Bureau of Family Health School-Based Health Centers, Louisiana AAP, Louisiana Office of Public Health Immunization Program, Louisiana Primary Care Association, Louisiana Shots for Tots Coalition, the Louisiana Vaccine Alliance, LSU Health Sciences Center Dental Program, and the Southeast Louisiana Area Health Education Center. The Louisiana AAP is accredited by the Louisiana State Medical Society to provide continuing medical education for physicians. The Louisiana AAP designates this enduring material for a maximum of 0.25 AMA PRA Category 1 credits. Physicians should claim only the credit commensurate with the extent of their participation in this activity. For nurses, the 2021 HPV Summit has been approved for a total of 1.75 contact hours of nursing continuing education by Workplace Nurses LLC. Workplace Nurses LLC is approved as a provider of nursing continuing education by the California Board of Registered Nursing, CEP number 13654. To claim credit, nurses must view all 4 sessions in the series. No partial credit will be given. Today's presenter is Pankti Pathak. She is the Director for the Health of America Research Initiative at the Blue Cross Blue Shield Association. She is responsible for the development of data-driven content for the Health of America Report Series, provides research support for the Blue Cross Blue Shield Alliance Health for Health Research, and manages the evolution of the Blue Cross Blue Shield Health Index. She has over 10 years of diverse healthcare experience spanning over payers, pharma and biotech, providers, government organizations, and nonprofit organizations. She has a Master's of Public Health from George Washington University and a Bachelor of Science in Microbiology from Texas Tech University.
Well, the United States has benefited from very low rates of vaccine-preventable diseases. Diseases like polio have been completely eradicated from the country's population. Unfortunately, this trend is reversible. In 2019, the World Health Organization identified vaccine hesitancy as one of the top 10 threats of global health. In 2020, the disruption to the healthcare system as a result of the COVID-19 pandemic has further slowed vaccination rates in this country and around the world, putting the population at increased risk of vaccine-preventable diseases. Now, over the next few slides, I'll be sharing with you vaccine trends we've identified using our Blue Cross Blue Shield claims database for 2 populations: children ages 0 to 3 and 2 children ages 10 to 13, examining how vaccination rates for both populations have trended over time, how it varies by race and ethnicity and attitudes, and how the COVID-19 pandemic impacted vaccination rates. So in 2018, we published a report looking at completion rates of the Childhood 7 vaccine series. This vaccine is a critical vaccine given to children between the ages of 0 and 3 and protects them from a range of diseases like mumps, measles, whooping cough, Hep B, and polio. In 2018, the report saw an encouraging trend that there was a rise in completion rates, increasing from 69% to 79%. However, when we updated the trend this year, adding 2 birth cohorts, 2015 and 2016, we saw plateauing for the completion rates for this important childhood vaccine, plateauing around 80%. And that trend is likely not going to improve as many children missed receiving their 7 series vaccines during the pandemic between January and September of last year. 7 series vaccines decreased by 6% compared to the same time in 2019. Now, when looking at vaccination rates of the individual vaccines in the 7 series, we saw that 2 vaccines, DTaP and pneumococcal, have markedly lower rates of completion, driving down overall vaccine completion rates for this group of vaccines. DTaP and pneumococcal each require 4 doses, which may be a barrier to completion. Ensuring full dosage of both would raise the total vaccine series completion rate from 80% to 84%. And on a side note, rotavirus and Hep A vaccines, both falling outside the 7 vaccine series, but recommended childhood vaccines have respective completion rates of 82% and 89%, but both plateaued in 2018 following the same yearly trend as the other vaccines for this age group. Now, when examining the rate of wellness visits among children ages 0 to 3, we noticed higher completion rates of the 7 vaccine series among children who had attended at least 10 well-child visits, a 30% higher completion rate of the vaccine series, underscoring the importance of wellness visits and the need to get children into the doctor's office for them. When looking at vaccination rates by race and ethnicity, we saw that children in majority Black and Hispanic zip codes have much lower vaccine completion rates for the 7 vaccine series compared to children in majority white zip codes. For example, children in majority white communities had an 80% completion rate for the 7 series vaccine, while children in majority Black communities had a completion rate of 73% and 69% for children in majority Hispanic communities. What is even more concerning is that Black and Hispanic children in these zip codes are 15 to 45% more likely to have not received the first dose of multi-dose vaccines by age 3, like DTaP, polio, or Hep B. To better understand why we're seeing this disparity in vaccination rates, we fielded a survey across almost 1,000 parents, and what we learned was that Black parents have markedly different viewpoints on vaccine efficacy and necessity compared to white and Hispanic parents. 76% of Black parents believe that childhood vaccines are successful at preventing disease compared to 90% of white and Hispanic parents. 72% of Black parents believe vaccines are necessary to protect the health of children compared to 87 and 91% of Hispanic and white parents. And 69% of Black parents believe childhood vaccines are even more important during the COVID-19 pandemic compared to 86 and 82% of Hispanic and white parents. So we're seeing higher percentages amongst white and Hispanic parents compared to Black when it comes to the importance of childhood vaccines during the pandemic. These insights highlighted how differing beliefs around vaccines could be one of the drivers around lower uptake of important childhood vaccines in communities of color. Similar to the 2018 report on the 7 series vaccine, that same year we also published a report on adolescent vaccination rates in America, examining vaccination rates for Tdap, meningococcal, and HPV vaccines, all recommended for children ages 10 to 13. Vaccination rates for Tdap and meningococcal vaccines remained steady at 94 and 90% completion rates. For the HPV vaccine, however, were under 30% for completion rates. Now, the HPV vaccine is recommended to be given to children between the ages of 10 to 13. It can be given later, but recommended in this time window. It is a 2-dose vaccine, and most states do not require children have received the vaccine before starting school, unlike the 7 series vaccine, which we discussed earlier. Since our 2018 report, we added 2 additional cohorts of data, 2015 and 2016, and continue to see an increase in initiation of the first dose of the HPV vaccine, a 46% increase from 37% in 2013 to 54% in 2016. However, growth of completion rates is much slower, at about 16% from 25% in 2013 to 29% in 2016. And these trends are likely to decrease with the impact of COVID-19. During this time, many children missed doses of HPV vaccine. Between January and September of 2020, HPV vaccine rates decreased by 19% compared to the same time in 2019. Initiation of the HPV vaccine has increased for both genders since 2013, with rates growing fastest among male cohorts at 56% compared to just 38% for females. However, the growth in completion rates is highest amongst females at 27% versus only 7% for males. Overall, completion rates for both groups is still below 30%, well below the Healthy People 2020 goal of 80%. Similar to the 7 series vaccines, increased wellness visits appear to be an important step towards increasing vaccination rates for this age group. HPV vaccine completion is more than 5 times higher for those with 2 or more wellness visits in the 3-year span compared to those who did not have any wellness visits. Again, underscoring the importance of wellness visits and their benefits in ensuring children receive recommended immunization. In addition, pediatricians can use wellness visits to further educate parents on the benefits of vaccines like the HPV vaccine. In a survey we fielded last year, we learned that almost 30% of parents chose not to give their child the HPV vaccine because they were unsure about the vaccine's efficacy. In addition, 25% of parents did not give their child the HPV vaccine because the vaccine was not required, and 22% had concerns about side effects of the vaccine. Now, the breadth and depth of our claims database allows us to examine health trends at the local level as well. So here we have vaccination rates for the 7 vaccine series in 2019 in Louisiana, and then by 2 major MSAs, New Orleans and Baton Rouge. Compared to national percentage rates of 80%, Louisiana and the 2 MSAs have lower completion rates for the 7 vaccine series, from 74.8% in the state and 75.7% in New Orleans and 78.4% in Baton Rouge. Lower compared to national rates, but we're seeing some variation by community. When looking at individual vaccines, rates vary, with some MSAs and the state seeing higher completion rates than rates nationally, but nothing was substantially higher. Similar to national trends, completion rates for DTaP and PCV, the pneumococcal vaccine, have the lowest completion rates in Louisiana and the 2 MSAs. For HPV vaccine rates, trends in the state and same MSAs are similar to what we're seeing nationally. High first dose rates for vaccine, with 48.5% in the state of Louisiana compared to 54% nationally, and 51% in New Orleans and 54.6% in Baton Rouge. First dose rates are high compared to completion rates of the vaccine, where again, we're seeing completion rates below 30% in the state and MSAs. Now that's all I have for you today. I hope the trends I shared shine a light on the state of childhood vaccines in the U.S.
Thank you for watching today's presentation. We hope that it was educational and gives you ideas for implementation. After viewing all the presentations in the series, please complete an evaluation feedback form by scanning the QR code you see on your screen or going to www.surveymonkey.com/r/2021 LA-HPV Summit. Your feedback is valuable as we continue to plan future events. In addition, you will be asked for your mailing address. As a participant in the series, you will receive a copy of all presentations on a flash drive, in addition to several other resources. We hope this has been helpful to you. Should you have additional questions or want additional information, please reach out to the Louisiana AAP either by calling 225-379-7923 or emailing admin@laAAP.org. Thank you again.